on her whenever you're ready.
I am ready.
Okay, so we have Miss Charlotte here. She is a 34-year-old female for Dr. Smith. No known allergies. So she came to the hospital with a deep vein thrombosis in her right leg. So Dr. Smith went ahead and started her on oral warfarin, or as we may know, Coumadin, 7 milligrams per day for the past 4 days, and the normal is, loading dose is 5 to 10 milligrams per day. They went ahead and are maintaining it with 3 milligrams per day. The normal is around 2 to 10 milligrams per day. And they can give it IV, but the doctor said let's just do it oral.
Okay, is that because she's going home with it?
Yeah,
Okay.
he said she's looking pretty good, so they want to keep it on oral.
Okay.
So she denied any contraindications, so, no blood dyscrasias, eclampsia, alcoholism, bleeding, and no head trauma.
Okay.
So I went ahead and educated her on warfarin, explained to her, it's a vitamin K antagonist, but, also known as an anticoagulant, which helps with her current blood clot in the right leg, and also prevention of the new blood clots by depressing the hepatic synthesis of the vitamin K clotting factors. She understood. The doctor went ahead, he made his rounds, said she looks great, and if everything lab-wise comes back, then she can go ahead and go. We just need to take that IV out, and I'm going to start the discharge paperwork. Do you have any questions?
No, so the doctor just wants us to go ahead and take the IV out now?
Yep, and look at the INR, see how that's doing, and if it's okay, she can go.
Okay, I'll just take the IV out.
Perfect, thank you.
Thank you.
Hey, Mom. Yeah, I get to leave. They said that if my blood work comes back okay, I can go. I just have to take my IV out, and she should be in any time. So, I think she's here now. I'll talk to you later. Love you. Bye.
Hi.
Hi.
I'm Brittany. I'm your new nurse.
Nice to meet you. I'm Charlotte.
I heard you were getting discharged today.
Yes, I can't wait.
You already got your street clothes on.
Yep.
Well, we're just going to go ahead and take your IV out real quick, and then they're getting your paperwork ready, and we can get you on your way.
Perfect.
Do you have any concerns right now? Any questions?
I don't think so. I'm just ready to get out of here.
Okay. All right.
I'm just going to hold up here for you.
Ow! They say do it fast, but I don't know if that really helps.
Yeah. Just, if you got to rip it out, that's fine. Oh, man.
A little bit of blood.
Okay.
Wipe it off.
Okay.
I'm
I'm gonna move out of the way here.
I'm gonna need some more gauze. That's not stopping.
Fine.
Okay, I got some. Wow,
am I
that's
supposed
a
to be
lot.
bleeding this much?
No. Let's get some pressure on that.
Do you want me to hold it?
Yeah, can you go ahead and apply some pressure for me? I'm gonna go ahead and call the physician. You're on Coumadin, right? That's what the nurse told me.
Yeah, they started that.
Have
I don't know what day.
Have you taken an extra dose today or anything?
No. I did take some aspirin because I had a headache earlier.
Okay.
So.
Well, I'm gonna go ahead and call the physician. We're probably gonna have to start you a new IV.
Okay.
And then give you some vitamin K because that's the antidote for Coumadin.
Okay.
So let me go ahead and take care of that. We're just going to need to put a lot of pressure on it. I'll be
Okay.
back in like 1 minute. I got to get a hold of another nurse.
Okay. Does this mean that I can still go home?
No.
Oh.
Not right now.
Come in.
Hi, Miss Charlotte.
Hello.
How are you feeling?
Better. There's not as much bleeding.
No, here, let me take a look.
Okay.
Yeah, it is a little bit soiled, so we're going to have to change the bandage. But
Okay.
first I wanted to do some patient teaching, and I wanted to let you know what the doctor said.
Okay.
I talked to him just about 10 minutes ago, and he said that we're going to go ahead and keep you for a couple more days.
Oh.
Yeah, I know you really didn't want it, but it's the best thing right now, because if this happened at home, it could be very dangerous.
Okay.
So I'm going to educate you on your warfarin a little bit.
Alright.
First, we're going to go ahead and monitor your INR while you're here. That's the main reason we're keeping you here, is so we can monitor that INR level. The INR level, it tells us how thick and how thin your blood is. So earlier, your INR was very high, so it thinned out your blood a lot, which made it kind of like water. And so when we took the IV out, it just spilled out.
Okay.
So that's what happens when we take too much warfarin. So when we keep you here in the hospital, we're going to test the levels of the warfarin and what works out best for you and what will keep you within that 2 to 3 range for the INR.
Okay.
Do you have any questions so far?
Well, I was thinking about getting pregnant, so could I stay on this if I wanted to get pregnant?
Well, warfarin is a pregnancy class of a category X,
Okay.
and that means no. You shouldn't
Okay.
take warfarin while you are pregnant. But that's okay because there are other drugs in the anticoagulant class that you can take.
Okay.
I know Lovenox for sure you can take while you're pregnant, and it is safe to take.
Okay.
Now we'll just go ahead and talk about the side effects for warfarin and what you need to look for so
Okay.
that it doesn't get to the point of your blood being that thin. So you can notice subtle side effects before, and then you can come to the doctor and get help.
Okay.
You're going to look for side effects like anorexia, nausea, vomiting, diarrhea, alopecia, which is your hair falling out.
Oh, okay.
Abdominal cramps and rash, and then if you get a fever, you should always come in.
Those sound horrible.
Yeah, they can be pretty bad.
Okay.
But there are some adverse effects that you should know about too that are even worse. There's this adverse effect called purple toe syndrome,
Okay.
and then also hemorrhage. You should be very careful of hemorrhage, which is kind of what happened earlier.
Yeah.
Okay, now the next question I have for you is, what kind of medications do you take at home?
I'm not really on a set schedule. I do take aspirin every once in a while for a headache, and then a couple weeks ago I was on an oral antibiotic.
Okay, with warfarin, there is some drug interactions that you should be aware of and to avoid taking.
Okay.
You said you had taken aspirin and a oral antibiotic, is what you said?
Yes.
Okay, there's one of two things that can happen with these drug interactions. The drugs can either increase the effects of warfarin or it can decrease the effects of warfarin.
Okay.
Now, when the effects are increased, that means that your blood is going to be thinning, and it's going to be like water, like earlier.
Okay.
If it decreases the effects, that means you're going to be more susceptible to getting another clot, like your DVT.
Okay.
So aspirin is known to increase the effects of warfarin. So you need to use caution whenever you are taking aspirin.
Okay.
And you need to look for subtle signs of bleeding, such as bruising or bleeding gums when you're brushing your teeth, or just random nosebleeds. So you need to be aware of those and come to the doctor as soon as you see any signs of bleeding.
Okay.
There are also some other drugs, though, that increase the effects of warfarin, and that's things such as NSAIDs, vitamin E, diuretics, and your oral antibiotic will also do the same thing as aspirin and may cause you to bleed.
Okay.
Now, medications that cause decreased warfarin effects would be things like laxatives, estrogen, vitamin C, and like oral contraceptives.
Okay.
So just use caution whenever taking those medications, and you should always consult your doctor before starting any medications, and that includes herbal supplements and over-the-counter medications, not just things you are prescribed.
Okay.
Any questions?
I don't think so.
Okay. As a nurse, what I'm going to do for you while you are here in the hospital is I'm going to check your INR, like we were talking about, and I'm going to check your PT, which stands for prothrombin, and that is checking about the same thing as the INR. We're just checking the therapeutic level of warfarin.
Okay.
And the PT should be somewhere in between 11 and 18 seconds.
Okay.
Okay? And I'm also going to watch your vital signs to watch for hemorrhage. So if your pulse ends up increasing and your blood pressure drops, then maybe we can assess for hemorrhage before the hemorrhage even happens. It could be an indication that a hemorrhage is occurring.
Okay.
So we don't have a mess like we did earlier. And another thing to watch with bleeding, like I was telling you about your bleeding gums and all of that, some ways to get around that are to use a soft bristle toothbrush, and then just use caution when shaving. Very much caution, because that can cause some intensive bleeding.
Okay.
For your diet, you should stick away from foods rich in vitamin K, because like earlier, whenever you had the bleeding problem, we used vitamin K as the antidote to clot. So
To kind of reverse it?
yeah.
Oh, okay.
Vitamin K helps with the clotting.
Okay.
So if you take in too many foods with vitamin K in it, then it's kind of going to reverse the effect of your warfarin, and your warfarin's not going to work as well.
Okay.
So green leafy vegetables is a great example of a vitamin K rich food.
Okay.
Do you have any other questions for me?
I think that's it.
Okay.
Alright.
Well, I will be back to check on you soon. I'm going to get some supplies to change your bandage.
Okay. Thank you.
All right.
This has been a warfarin production.